Welcome back to another episode of the Brawn Body Health and Fitness Podcast. Joining me again today for a second time on the show, but with a different last name, Meghan Sak-Ocbina. Meghan is a doctor of physical therapy, athletic trainer, and strength and conditioning coach. She is doing so many incredible things in the field of PT. Today, Meghan and I are going to be discussing injury and movement and the language that we use around it and how we approach it and so much more. We kind of put the traditional PT model on the back burner and kind of propose some new things that we think would benefit people more. So, this might come as a surprise to you, but we are not big fans of hot pack ultrasound massage and, 50-minute passive treatment session. We think that there might be a better way to do it. And that's kind of what we discussed today in the show. It's a great episode, great listen. And as always, all of our episodes in season 5 are brought to you by Isophit, my go-to for all things isometric strength training. For more on Isophit, you can check the description below. Enjoy. Meghan, welcome back to the podcast. So much has changed since I last saw you and chatted with you. I'm excited to have you back on.
Yeah, thank you so much for having me. I'm excited to chat and catch up. I don't even remember when the last time was. I feel like it was like maybe right after PT school or maybe right before I was done. Was it January? I don't remember.
I think it was like fall of 22. It's been over a year.
Okay, so it was before PT school. It was over then, before I graduated. Wow, yeah, a lot has changed. letters behind the name, last name has changed. Career has like taken a different direction a little bit, so wild.
It's amazing how much can change in a year. But for people who maybe haven't kept up to date with you, or maybe they don't follow you on Instagram, which is a huge mistake on their part, would you mind filling them in a little bit about all the amazing things that you do day after day?
Thank you very much. Talking me up a little too high, I think there. But so my name is Meghan Sak-Ocbina. I am a doctor of physical therapy and a strength and conditioning coach. I primarily work with people virtually, which was not my original plan when I went back to PT school. Previously, I had become an athletic trainer, which was my master's degree, and then decided to go back to school, wanted to be a PT. And during school, I started doing, I was a strength conditioning coach already as well. So I started doing some a little bit of online programming coaching, just to kind of, pay some bills on my own because school is very expensive. And while I was doing that, I was sort of, just growing my social media. Instagram is primarily what I use. And then, graduated PT school, took a job with the last company that I had my rotation with. And then just my online coaching just sort of exploded earlier on this year in 2023. So decided to go off on my own completely and do primarily online coaching and started a cash practice in person. That was actually my original goal, was to have a cash, out of network practice physical therapy in person, purely in person. That was my original goal when I went back to school. And then, the whole online thing just sort of that opportunity popped up and it just made sense, because I'm very comfortable with the online world, just because I've had a little bit of experience in it. I'm obviously learning as I go, like we all are, but so that's what I'm doing right now.
It's amazing to see what you've built and all that you are doing, Meghan. And it's one of those things, by definition, you're a physical therapist, but in a lot of ways, you're kind of taking that and making it your own. Not a whole lot of PTs are working primarily with individuals virtually or online, but you are. I'm assuming that you work with some individuals online, or maybe they're seeking you out because they have an injury, or maybe they've had an injury in the past and they're struggling to come back from that.
Yeah. So with the online thing, obviously, we can't call it quote unquote physical therapy because I'm not licensed everywhere that people exist. And some of my clients aren't even in the United States. But primarily the people that, want to work with me, and I know plenty of other coaches actually that are doing the same thing just because I'm in that world. So it's, I meet other people that are doing it. So yeah, usually there are people who either are, feel like they've been kind of just sidelined by the same injury over and over, and the traditional model of PT hasn't really helped them. Or maybe they don't even have an injury. They're just trying to get stronger and want to understand a little bit more from a deeper level. And so I would say that's the majority of my clients. I work with a lot of women postpartum as well that are, trying to like rebuild uh, of their body essentially after all that it's gone through with pregnancy. Those are some of my favorite clients to work with, honestly, because I feel like our system really fails women when it comes to most things, but especially postpartum. I think it's we're definitely lacking in that area. So yeah, it's been really great, and it's cool to be able to reach people from across the globe, honestly. Obviously there's limitations with online as well, and there's always that to be said. So sometimes if someone's not appropriate for virtual and they would just benefit more from in person. I know people all over the place, and if I don't know someone else that I respect and think highly of, to know someone that can refer to that person's area. So that's what's cool about the online space, is like the 6 degrees of separation really starts to come into play, and you can really you can help people a lot easier, I think.
Yeah, definitely. I love that point. It's hard to believe that a traditional PT model that sees 3+ patients an hour and features a heavy use of modalities, hot packs, cold packs, and some basic stretching and table exercises. It's hard to believe that would fail people and
I
lead
know,
them
shocking.
to re-injure or things flare up. I can't imagine. Um,
Yeah,
yeah,
right.
it's one of those things. I see that far too common myself. And it's weird seeing people who have been in PT for 4, 5, 6 months, and there's no progression. So I think this is an area where the industry as a whole could do better. But until that happens, I feel like this is a prime spot for someone like you who has that knowledge, but someone's not really in a quote unquote traditional PT setting, right? This is not an acute injury. This is something that's happened a long time ago. They need to get training and loading heavier to actually get a handle on it, but they don't know how. And unfortunately, the majority of clinicians don't know how to equip that patient to do so.
Yeah, they don't. And the worst part is, like, I feel like a lot of people don't even really understand what PT is. Sometimes because they've been to a PT and the PT sucked. Other times just because like we don't, like, if you've never even been to PT, you just think it is like just like stretches, or like the PT stretches you all day or whatever, makes you feel better. It's like massage, and it's not like that. PTs are coaches. Like literally, we are coaches with doctorates who teach people how to move, which movement could fix so many of our problems, like not only like the physical, like musculoskeletal problems, but like the diseases, the chronic diseases that we all suffered with, like as a country, like diabetes, heart disease, things like that. Like exercise is the solution. So I think I hope that things are going to change, and that people's eyes are going to be opened as to like what the benefits of just movement and like having the accessibility to like a physical therapist even online, in more of like a consultative, what's the word, consultation
Yeah,
setting.
yeah,
I think that is going to be pretty pivotal, for the physical therapy industry, at least, because I mean, just with how insurance really runs the show for most physical therapy practices, and they're forced to see that many people an hour because they don't get any money from their patients. And you're like have a family to feed, like you're kind of just stuck in this weird, sort of no one wins at once, and the patients are all being seen at once, and then no one wins.
yeah.
So
No,
an insurance company, they win.
you're absolutely right. No one wins in that model. And injuries, which should have gotten handled and addressed early on, suddenly become something that plagues someone for a long period of time. And instead
Yeah,
of just occurring, acutely, and we get it better and we teach someone how to go back to what they want to do, while keeping that tissue injury in mind, it instead causes this like downward spiral of just re-flare up over and over and over again. And it's very difficult to get people to break that cycle. I mean, when I hear injury, at least for my own standard and definition, it essentially boils down to the fact that the load put on a tissue exceeded its capability or capacity to absorb or, take that load, for lack of a better way to put it. Do you see the similar cycle of just downward spiral effect from injury? And I mean, what do you think really causes the injury to occur in the first place? And what else should people know about injuries that they're facing?
yeah, no, I couldn't have said it better myself. Like an injury is comes when a tissue is, I say asked, or it is demanded to be doing something that it's not prepared to do, whether that is, you know, acutely, like maybe you pivot like weird once on the field and your ACL, you know, tears or whatever. Or, you know, maybe you just don't move very well, or you have poor mobility and you're doing bench press for a long time and your shoulder eventually starts to hurt. And there's no like pinpoint time when it happens, but it's just that you were demanding more of the tissue than what it was supposed to be doing. And then I think the issue is that a lot of the times the solution is to, you know, rest, like let it calm down, which obviously if you don't use the area, it's not going to hurt, right? So you might think that it's better. And there are times, for sure, there are times when rest is necessary, you know, like a fracture or like post-operative, those kinds of things, when you need time to like let that tissue just sort of heal acutely. But for the most part, like it's a load management thing. So just like if you were going to try to go get stronger in the gym, like progressive overload, like loading over time slowly, so your body has time to, you know, break down a little bit and then adapt, break down a little bit and then adapt. That's the same thing. Rehab is the same. You're just starting from a different floor, right? Like training, I think of as like, you know, they're closer to the ceiling. Rehab, you're closer to the floor. So someone's, you know, their capacity is within all of that. When you get to the ceiling, you're able to, you know, you're like pushing almost to your limit, but you have like your one weakest link, and that's the injured tissue, and that's what's going to keep you kind of in this like floor area. So you have to build up from there. You can't build down from the ceiling. Does that make sense?
It does. I love the floor and ceiling analogy that you just laid out. And I kind of say it similar. There's level 1 and there's level 100. And if our goal is to get to level 100 and we have someone at level 1, first off, we have to know what level 1 looks like. And second, we have to have a progression in mind to take them from where they are to where they want to be. So I love your definition of injury, and I love the breakdown that you just gave about the importance of progressing someone back over time. And to your point, you know, rest more often than not is not the answer anymore. You know, I think of a lot of the people I see after ACL surgery, and we're getting them going 16 hours after surgery. Like we're not waiting that long. That whole acute phase of rest and protect it for a week, that's kind of going to the wayside. And I think it's for good reason. You know, if we don't start moving things early and start reintroducing movement early, it becomes very, very difficult to get it back. And to just stop and think about how difficult it would be to have someone who maybe went 2, 3, or even 4 weeks in that protection phase, whether it's post-op or just acute injury. I mean, it's a very uphill battle to get them back to where they want to be.
Yeah, well, and I mean, even that, like, that's what is so important about getting in so quickly to PT, especially post-op, because you can, if you can't move things actively, you can usually move them passively, you know, and that's like what a skilled physical therapist can do. And then isometrics, like you can always do, you know, like muscle setting, like even the simplest things, like those can always be done. But there's, like you said, there's a lot of, like, I think we're kind of realizing like we're not as fragile as we once were thought to be. And like you can do stuff acute post-op that we wouldn't have thought that you could do before, for sure. The other thing I was going to say is that a lot of time people are not even, especially with like chronic things or with acute things, like they're not considering nutrition or like the overall allostatic load of like the rest of their stressors in their life. So like, are they sleeping like shit? Are they eating like shit? Are they super stressed out of their mind with work? Are they, you know, their kids driving them crazy? Like, there's all these other factors that are going to affect your ability to recover from like the physical stress, and whether that's like training and like trying to get better in the gym, or whether it's like trying to, you know, recover from an injury, because they're the same thing, just, you know, slightly framed slightly differently in our brains, I guess. Like one is more, I guess, not positive, but just, you know, you're not as irritated that you're training as you are, you know, in an injured situation. But yeah.
It creates this hypothetical situation of why the injury occurred. You know, as you mentioned, a lot of times we think it's acute and just happens all at once. Things rupture, things break, things snap. But maybe it's actually more of a traumatic stress type element. Maybe we never gave the tissue a chance to recover from a sleep standpoint, or didn't give it the building blocks that we need to rebuild tissue after we inflamed it during exercise. So a nutrition standpoint. Or maybe it's just a misload issue, or maybe it's how we move that's putting too much load in a certain area, and not a acute rupture. It's we've been doing that over and over and over again for a long period of time. And eventually, instead of bending, things break.
Yeah. So speaking of which, we could talk about mobility and strength training and mobility and things like that. Because I was inspired by what you just said. Like, if you like, people think like lifting makes you tight or immobile. Like lifting in a limited range of motion or existing in a limited range of motion makes you tight and immobile. Like that's, it's the same concept. You're just loading things heavier. But one of the best ways to allow things to bend instead of break is to literally train them to bend instead of break. Incrementally getting your body used to those kind of extreme ranges. Something is extreme, like by definition, I think of it as, it's abnormal. It's out of what you're expected to be doing versus if you're, regularly going to that area under control in a controlled setting, over time, like it's not going to alarm the system as much as if you wind up there, like on the field or things like that.
So you mean instead of avoiding positions, we should actually like train them?
Yeah. Isn't that weird?
Shocking.
It's like, it's so counterintuitive, but yes.
It's almost like everything that they teach you about injuries from 50 to 100 years ago needs like a whole like refresh or like a new framework almost.
Like completely wipe it and let's just talk about it differently, basically.
Yeah. Let's completely start over. No, I love that approach. I love what you just laid out, Megan, is to your point, instead of avoiding positions over and over and over again, let's actually increase tolerance and increase our capacity to move in that position. And I think you're the queen of progressions, regressions when it comes to that. I mean, you're super creative in the things that you think of and how to do that, whether it be at end range or incorporating different types of equipment in and so on that way. So I love where your head is at in regards to how we should train around injury.
Thank you. I appreciate that.
As we kind of alluded to, I think that there's a big misunderstanding around injury. And as we kind of outlined, it's one thing to know and understand an injury, but at the end of the day, we're not treating injuries. We're not treating diagnoses. We're treating people. And I think that's something that a lot of PTs, strength coaches, I'll throw ATs and chiros, I'll throw everyone in the mix. We're just going to throw everyone under the bus, myself included. We kind of forget that we're treating a person sometimes, and we kind of focus solely on the diagnosis. And I think as a result, the language that we use kind of gets lost in the shuffle. We start talking about the injury, we start talking about all these different sciencey terms because we know our shit apparently, and then we forget that the person in front of us is in tears because they literally just had a crazy thing happen to them.
Or we don't think about like what the implications of this injury are, to them psychologically. Like, yes, maybe they are in pain, but also like it affects, their ability to go and, play with their kids or go like to the gym for mental and physical health, so it's like always a lot deeper than just like, oh, my knee hurts, and it's also, I think I try really hard to like explain to my patients, first of all, how pain works. Like, I think that's becoming pretty normal for, most PTs to talk about like pain science and like sort of like how pain is, it's your, I don't remember who said this, Lorimer Moseley, maybe, not sure if that's correct. But like pain is a request for change. It's your brain being like, hey, like this isn't good. Like, can we not do this? Like I'm worried. This is dangerous. That's basically all it is. And that may be because it is actually dangerous and there is actually damage. Like maybe you just stuck your hand on a hot like pan and you're burned now. Or maybe it's like, you were injured at one point and so you're automatically just like on high alert, and so you'll feel pain that doesn't even indicate that there's any kind of damage, because that's totally a thing too, especially with like chronic stuff. Chronic stuff and chronic pain is so complicated because it's like there's so many layers, like physically and emotionally and mentally, that you have to like kind of uncover, and it takes so much communication with the person, and you got to tread lightly too, because you don't want someone to, you tell someone that pain is created by your brain and they think you're saying that it's in their head, like they're crazy and it's not real, so I think what I try to do is just, educate people on like why things happen and how, you can sort of, give an analogy of something else where, maybe something that they can relate to in their life where there wasn't damage, but like maybe that they were a little bit scared or things like that. And then also just pointing out like little wins, because someone that's in kind of an acute, painful situation, like they're going to have kind of this tunnel vision of like they're scared of the thing that they don't understand. Whereas like if you can take them in a session, someone that's had back pain for 6 months, take them in one session and have them be able to like deadlift something off the floor with zero pain, like that's a huge win, and that's like, hey, an indication like there is a little bit of a glimmer of hope, that we can work this up to a better tolerance. And that's like honestly my favorite part of the job, is being able to like give someone that like that autonomy of their own body again, because I think a lot of the time especially people that are in pain for a long time, they're scared. Like they're literally scared in their home, their house, their body. And that's what you exist in your life. Like that's where you are your whole life, and if you don't feel safe there, like that's going to have so many downstream effects.
Yeah, definitely. When you say it that way, it sounds like to a certain extent your job involves being a teacher, because you're educating your patients so much on what they do. And I think that is so missed. I think the person in front of you needs to understand what is going on. As you mentioned, they might be scared, they might be uneasy. And if they don't know what's going on, that's probably going to add insult to injury. And it's crazy how many people forget to explain this part. I can't tell you how many times I've worked with someone who, comes to me and they've done PT 2, 3, 4 months elsewhere. And I go, what are they treating you for? And they go, well, my knee hurts. I go, what do you mean? Are we treating like a patellofemoral thing? Are we treating like a movement-based thing? Like what exactly are we working with here? And they don't even know what they're working with. So how can you feel comfortable going, weeks, months, paying good money at that for something when you don't even know what's going on? So I think that the education piece is huge. And as you mentioned, I think that ultimately it seems like you're focused on giving the control back to the patient. You're not trying to run the show. You're trying to give the person in front of you the tools that they need to succeed. It's like when you're hurt, the locus of control is completely ripped from you. Now you're being told what to do and when to do it by everyone. And you're just flipping that 180 and saying, hey, actually, you're going to do this and you can do this and you can do that. And that's going to empower someone to come back a lot better.
Yeah. Well, even like the PTs, or not even PTs, like clinicians that'll tell a patient like, oh, like your SI joint's out, or oh my God, it's just like, okay, that is obviously not something that someone can fix themselves if that was actually a real thing, which it's not. But that like creates this like, oh, I need to go see you anytime this happens. Like it literally gives them like, you're just feeding people fish. You're not teaching them how to fish. And I feel like, you can help people for so much longer, and you're going to get such better results that are more long-term if you're able to like, explain to them why like out, like your SI joint out is not really like, it can feel that way, and sometimes it's just semantics. But I think like we just need to be very careful, because we are the ones with we're the highly educated people that are supposed to be teaching the people who do not have the doctorate in movement about their bodies. And if you can't teach something, like you don't actually understand it, and if you're telling someone something that's going to not like enable them or empower them at all, like why, what are you even doing? Like, why did you want to be in this profession if you're not actually helping people at all?
Yeah, the model is based on dependency, and we want people to depend on us, when in reality, someone like you is more like just out here trying to create strong, independent people day after day. Like, I would love to go in and not have any patients to treat because no one needs me and everyone is independent and knows how to tackle things on their own. Like, that would be a great day for me. Unfortunately, that's not reality, but that's what we're trying to get to, I think, is we need to break this model of dependency. And as you mentioned, it starts by teaching the person in front of you. And you mentioned that you educate them a lot on what I'll call like the background or textbook stuff, the pain science, why they have what they have right now, whether that's pain or a movement deficit. And then obviously you teach them what they're going to do about it. But or what you're going to do about it and help them do about it. But it goes more than that. It's not just understanding, it's actually doing. And I think this is an area where you really shine, is your ability to coach and cue movement. So how do you go about teaching someone exercise and movement? Because there's a varying level of individuals out there. Some have, exercised their entire life, and others have never stepped foot in a gym, right?
Yeah, it's like my favorite thing ever, honestly. Yeah, I mean, I just think this is gonna sound maybe bad, but like I kind of think of us as like puppeteers, and our patients are puppets, but like not in the sense that like we're gonna control them forever, but just like kind of like we can like, give them the external cues that are necessary to get them to do what they need to be doing with their body, because I mean, some people, especially with pain or with people that just aren't good movers, or maybe they have like, they were taught how to squat by someone who didn't know how to teach how to do a squat. And then for, 20 years, they're squatting with their shins perpendicular to the ground, which is obviously not a squat, that's a hinge. But anyway, but like just being able to like give them something to focus on, like external cues that can allow them to, they're not like overthinking the movement, because if you give them like, if you're trying to teach something complex like a deadlift and you're, telling them all the different things that they need to be thinking about at once, like their head's going to explode, right? Whereas if you can just kind of like piece it together, or maybe like start with a variation that kind of takes care of a couple of the cues just because of the position that you wind up in, like a front loaded, like good morning, that kind of thing. That's a really good one for like teaching a good like stack. But yeah, I mean, and it's always like, there's no perfect algorithm for the human body. Like I tell people all the time, like, I wish you were like a car and I could just like look under the hood and be like, oh yeah, so this is like, I don't know cars at all, but I'm assuming it's a little bit more straightforward because you're like, okay, well, this isn't working. So, and if this isn't working, then you got to go to this, and it's sort of like that with the human body, but there's so many more layers of complexity because you have like the mental aspect and their experience, like, both their like, fearful experiences, but also just like what sports background do they have, or like what movement background do they have. And there's just always, there's never like a perfect like algorithm for it. And which makes it like so frustrating sometimes, but also so rewarding, because when you can like finally hit home with someone, it's pretty cool, especially when you can get like really, really big results in like, an hour. Which obviously they're not going to be long lasting. You got to make those like little deposits every day, but it's just cool to be able to give someone back something that they thought they would never have again. So
Exactly.
yeah.
And
Yeah.
as you mentioned, there's not really one right way to coach and train movement. And
Yeah.
to the list of variables that you mentioned earlier, I'll throw in the difference in how people are built, right? Like everyone's
Yes.
structurally so different. I'm just
Yeah.
thinking of these two guys that I worked with before. One was easily 6'2"-ish,
Mhm.
and the
Mhm.
other one was like 5'7". So
Yeah.
naturally, they squat very, very differently. They hinge very differently, and they're naturally strong at different exercises. So
Mhm.
I can't coach the two of them the same just based
Mhm.
on the way that they're built and structured. And, unless something has changed, I don't think we've found a way to like magically give people an additional like 4 or 5 inches of height.
Right.
If we
Yes.
do, then someone's going to be filthy rich. But
Right.
we almost need to understand like the principles under movement and adapt them to the person in front of us, instead of trying to go at it as a one size fits all. This is how you squat, this is how you deadlift, period.
Yes, right. No, I completely agree. And also, I feel like something else that I've been trying to get better at lately is, like doing, like I'll demonstrate a movement for someone and then I'm like, okay, your turn, you do it, instead of like over coaching them and like just starting assuming that they have no idea what the hell they're doing, right? You want to see what their strategy is so that you can like be like, okay, well, how much am I gonna have to cue? Plus, like, does it hurt? How does it feel? Like, why, is it bothering you? If it doesn't bother you, there's a lot of different ways that you can accomplish the same movement. There's not like one perfect way. Like, you don't have to squat with your legs really narrow. You don't have to squat with your legs really wide. You can, different like deadlifting like form, like if you were always lifting with a flex back, that's fine. Lift with a flex back. If you're always lifting with a neutral back and then sometimes you flex, that's not ideal. Just because you adapt to load over time and you adapt to things over time and you're not prepared for that, kind of like what we were talking about earlier. But there's so many different ways to skin a cat, and like the whole point of like all of this is that our bodies are so adaptive, like whatever you're doing day in and day out, that's what they adapt to. So, someone's movement strategy isn't necessarily wrong just because it doesn't look like someone else's. Um, so I try to just be, I think sometimes people go into PT and they leave and they feel like, oh my God, I'm a shit show. Like I'm a mess. Like they feel worse. You shouldn't feel worse. You should feel like you have hope, basically. Hope and empowerment. Hope initially and then empowerment later. Kind of the
Yes,
goal.
exactly. Exactly. I love your approach with the demonstration too, because if you're in a traditional PT setting, or even if you're in a cash-based setting where you get like an hour with a patient one-on-one, you're probably not going to get everything you want in one session. You're probably going to need more to look at things. So if you demonstrate a new movement and then watch them do it, let them go for a set. What's it going to take? 20 to 30 seconds, if that. And at least for me, the question I always come back to is why, right? So if I see, hey, they're more protracted than I would expect, or hey, I want them here and instead they're going way back here. It's just a matter of why. Why are they doing that? Why are they in that position? Why is that comfortable to them? Why is that painful, or why is it pain-free? I feel like, to your point, things are complex and you just have to keep peeling back the layers like an onion. And the more you do that, the more you get to understand and appreciate where that individual is and why they are presenting the way they are.
Right. Yeah. And if something is painful, like that's kind of what we were talking about earlier. Like it's, say, for example, like you're having shoulder pain with bench press, right? You can like change the variation of bench press, like, figure out why it's hurting. Like, maybe you assess, like, are they limited in active or passive range of motion? Do they have like any of their, special tests, which take them with a grain of salt, but like, are there things that we can identify that might be the root issue? And then in the meantime, you can address those things with, correctives, and then change, like get them doing a horizontal press that doesn't hurt. Like whether that's like changing the depth, like a block bench or something like that, or like not doing barbell, or like changing their grip, doing incline or something. Like there's so many different ways that you can still have someone like doing a variation of movement and still getting like a good stimulus to the muscles. And like the joint is still moving without, pissing it off more. Because I mean, pain doesn't always equal damage, like we were talking about before, but obviously it can create like aberrant patterns. If you're like hurting when you're doing something, you're going to start to like compensate away from it, which is not ideal. So yeah.
Definitely. You had mentioned a second ago too about, you want people to feel hopeful and empowered after their session. And for many, I don't feel like that's their PT experience, which is sad. But I'd imagine making someone feel hopeful and empowered goes beyond just the education and the movement. There's got to be more. It's got to be the tone. It's got to be how you present yourself and your overall energy and enthusiasm levels. And I can tell you love this stuff because you talk about it all the time. So I feel like it would be almost natural for the clients that you serve to see that same passion within you.
Yeah, I hope so. I think so. Yeah, I mean, I think sometimes when people go to PT, it's not even, they don't really feel anything. Like they don't feel hopeless necessarily. They just kind of go and they're like, okay, well, I'm gonna see if it works. It's not like you should be within a session feeling that it's working. Like you should be able to get at least a little bit of like a win during the session, and the next session, you can get a little bit more. But I just think it's really important to for both parties to realize that it's a 50-50 thing. Like I am, as a physical therapist, you are coaching and guiding someone, you're educating them, and then as the client, like they have to like put in the work. Like you cannot do the work for them. And so I think that's probably like the biggest difference that I think needs to change for some people, is that they're not, as the PT, they're not making it seem like they're a team with the patient. Like, okay, this is the strategy. I'm going to help you understand what's going on, and then we're going to work on this together. Like I'm guiding you, but I can't do the work for you. And I think a lot of people go to PT and they're like, oh, PT didn't work for me. But that's because they were just given this like stupid handout of exercises that are, I mean, they're relevant to like the body part, but it's like they're so like discombobulated and not even relevant to like the movement that was hurting them. Like it's not saying that they're bad, but like they're not ever addressing like the actual like thing. or, you get people that, if back squatting hurts and your physical therapist doesn't know how to do a back squat, like how the hell are you expecting to get better? Like, first of all, you have to see the movement and be like, okay, well, this is wrong with this. That's why it hurts. And if you can't identify that, like, how are you gonna coach? Like, I don't know, it just doesn't make any sense. Like, there needs to be different types of PTs that people go to for certain things. And then, sometimes the traditional, like, 4 patients at a time model can maybe work in very weird cases, but I just think it's the majority of people would benefit from like one-on-one care that is actually educating them what's going on.
One-on-one care with someone who is knowledgeable about what they're teaching and instructing and practices it themselves. Someone who doesn't just talk about it, but actually knows how to do it because they do it themselves, right?
Yeah. Or if you don't, then, that's what you have a network for. Like, I don't do Olympic lifts, like barbell Olympic lifts. Like, I can recognize if something is really, really wrong, but like, if you're going to get into the nitty gritty of it, like, I'm referring out. That's not my realm at all. Kettlebell stuff all day, but barbell, nope. I don't have any interest in doing it myself. I definitely don't know how to do it myself. And so, I just think as you also, as a clinician, like, you need to recognize when, even if it's within your scope, like, if you know someone better, like, don't gatekeep, like, refer, like, it should be about the patient. It should be about like who the best fit for them is. And that's, again, goes back to like the having a network thing. Like, if you have a great network of clinicians that you trust, then you can really truly help people. I think a lot of people are, especially like if you're self-employed, like, they're probably worried, like, oh, I don't want to give up a client, but I personally, I respect when people that I am going to for help are like, yeah, I don't really understand how to do this, so I'm going to send you to this person who's way more of an expert. And I respect them so much more, because we can't all know everything, but you also have to be willing to put in the work and try to figure things out too, because there are scenarios when, you can just look something up. But when it comes to something really technical, like Olympic lifting or something like that, I feel like it's a different scenario. But
I love that, and I want to harp on that for a minute. I cannot echo the point of, I don't want to call it stay in your lane, but recognize your strengths and weaknesses. And I'll just throw myself under the bus because I love to do that. I have not rehabbed someone after a joint replacement in months, maybe even in 2023. I don't know if I've not taken anyone in 2023 from start to finish for a joint replacement. I don't touch anything related to pelvic conditions. I don't touch TMJ. I think I might have touched 1 or 2 wrist hand type things because they were, very high level sport athletic type things and weird mechanisms and whatnot. But in general, like, there's a list of things that I just don't touch. And it's not that I can't rehab it. I'm sure I could take a knee replacement from start to finish. I'm sure I could take someone after a shoulder replacement from start to finish. But that's not what I do on the day to day. And there's other people who do that every single day. So
right.
I could do it, but I'm not the best person for it. And by the same token, there's a time when you have to kind of go back and learn things and figure things out. And I've had a number of individuals who were sent to me after meniscus repair surgeries where they were still having almost the same symptoms, if not worse symptoms after surgery. So then it became a case of, hey, this is the kind of stuff I like. Now I've got to go back and kind of relearn and unpack, like, why are we still having issues even though things are structurally intact? So
Right.
I think that, to your point, there's certainly a time to send people to a different place because you can't do everything at the end of the day. But by the same token, you have to recognize when something is your kind of thing and you've got to dig in deep for it, because not every case, not every condition, not every person you work with is going to be easy and textbook. Sometimes you have to kind of go back and relearn and reevaluate and put a little bit more time in yourself. But that's what makes this profession so beautiful, in my opinion, is it's never just one thing, simple, straightforward and clear cut. There's always some kind of curveball that comes in.
Yeah, for sure. Well, I think also it's such a tricky subject because, like, yes, I'm the same with like the wrist and hand or like TMJ. Like pelvic, I'm more comfortable teaching or working with, but like, anything like below the elbow, I'm just like, no, I don't want it. Like send it to an OT, but at the same time, like the whole body is connected, obviously. And so if you think about it, like we need to, maybe you're having elbow pain in push-ups because of your wrist, or, it's everything is like the whole kinetic chain is obviously involved in everything. So in some ways I'm like, yeah, refer out for things, areas of the body that you're not interested in working with or that you're not very confident in working with. But on the other hand, maybe it's just a little bit of an imposter syndrome thing, but also just, you have to be able to like think outside the box and be like, okay, well, this is very related to, if you have TMJ problems, it's very connected to neck problems, which is connected to shoulder problems. So, just digging a little bit deeper and, as long as we know more than our patients, then we can usually help people. But yeah. So obviously, I just kind of said the opposite of what I said before, but it's just interesting because I'm always like preaching how the body's all connected, and it obviously is, but there's just, it's like a black, you think of like certain body parts as like black boxes that you're like, oh, I don't know how that works. Even though, the adjacent joint you'd be completely comfortable with. So it doesn't make a whole lot of sense. But
yeah, no, definitely. And I think at least for me, it's like we understand how the body works, but there's certain like especially post-op things that like I don't really know where to begin with. Like if you come to me after a hand surgery, like that's going to be me flipping through pages of a book because I haven't done it before. But if you come to me after a knee surgery, we're good to go. So,
right.
And I think it varies based on the phase of rehab you're in on that note too, right? Like you might not be comfortable working with someone right after a wrist surgery, but if they're, months and months out and they're trying to get back to handstands, then hey, maybe Meghan is your person for that.
Right. Yes. Yeah. Yeah. Because you obviously wouldn't want to like screw up a surgery or anything like that. But yeah, it's very interesting. I mean, and it's like anything in medicine. I feel like people end up, you specialize in certain things just because you've seen the patterns with certain body parts more often, even though like everyone's a specialist in athletic, obviously. But every ACL repair has commonalities. Like there's a spectrum, obviously, but everyone's gonna like have like quad inhibition or things like that, and so you're able to like get those reps in, it just makes you more comfortable with things versus like just be like, I don't know, is this normal? I'm not sure because I've never seen it before.
Yep. No, exactly.
Yeah.
So all of these things that we've discussed are relating to injury and how you treat your patient and how do you approach them are great, but we've talked about them a lot from an in-person standpoint, and you mentioned you also do online work, and I feel like that's a very growing, booming thing that didn't exist 10, 20 years ago. How do you adapt what you do and change what you do to the online model or the online world?
Yeah. So most of the people that I work with online are not like acutely injured. Maybe they have like a niggle that's kind of bothered them for a while, but it's typically not like I just did this, like I need a PT, so that's just that as a disclaimer. However, sometimes my long-term like performance clients do get injured, like unrelated to our training while we're training, and then we modify their training. But essentially how things work virtually for me is, we'll do the initial just making sure that we're a good fit for each other. And typically people, they're looking for someone to coach them, but also someone that has a background and understanding of how to like modify things according to like limitations or pain, and then also just like a way to progress out of it. So I, instead of like with in person, you would do like an initial evaluation, an hour or whatever. With my virtual coaching, our assessment's actually a week long. So it's almost like as if it was the first week of training, but it's designed to be, it's pretty like standardized, but then, if someone is struggling with something specific, I'll add in like a different test. But, we're testing like, the barbell movements or like, certain, the big global body movements, as well as like active range of motion, just to kind of see like where their limitations might be. And then also I'll have their subjective, obviously. So it's sort of this like puzzle. And then from that week-long assessment where they kind of like tell me how things are feeling, I can also see like on video that they send to me like what might be going on. And then they're subjective to basically from there, that's how I design their programming. And then from there, it's kind of just like we establish a program and then they go through it. And then they kind of that first week is sometimes a little bit like tinkering around because, you know, maybe I initially thought something was going to be really good for them and it just isn't clicking, or maybe it was not feeling really good and like there's nothing I can do to change their form, so we'll just change the variation, you know. So it's always like a little bit of like touch and go at the start, but that's what's great about it, is because if you have like that's what's nice about being able to like have a, you know, it's like almost like an HEP, like the homework that you're given at physical therapy, but instead of like, okay, do your homework and then hopefully you do it correctly, I'm not going to know because I'm not going to be with you. They can actually like send a video and I can tell them like, hey, fix this. I'll send them a video back a lot of the time and then be like, no, this is what you're doing. Try it this way or whatever. And that way you're kind of just like continuously talking. Like it's not like 24/7, obviously. But that's what's kind of nice about it, is that, you know, you can see bigger changes because you're manipulating more of their training and you're touching with them like multiple times a week versus just like seeing them once a week and then not for another week or whatever. And then, you know, who knows what else they're doing for their exercise. If you're their strength coach and you're training them for everything, like sometimes people don't realize like maybe something that they're doing is erasing every benefit they've had from their PT because they don't understand that they don't understand the relationship. Versus if you're controlling everything in their training, you can really like modify things and start to see results. So yeah, that's what I think is really cool about it. And then I do also do live sessions with people virtually. You know, obviously with time, it can get a little bit sticky, but if that's ever necessary, like we'll do like an actual session where I'm like live coaching them through things. Because some people will do that with new blocks, like new training blocks, just because they really want to be able to like get that live feedback. But for the most part, like that asynchronous really works for a lot of people, you know. And I mean, has to be the type of person that's willing to like do the work. So it wouldn't work for like everyone, but I don't think the people who aren't willing to do the work wouldn't even like seek out my coaching. So usually wind up with really awesome clients. It's been really fun. I never would have imagined I'd be doing this ever, no. But yeah, I guess I was setting myself up during school, but I didn't realize I was. So
yeah, and you've absolutely crushed the game with your online programs and just the overall impact you're having on the fitness, therapy, rehab community in general, Meghan. And I love the approach that you use to an asynchronous type of training. First off, the week-long assessment is amazing. Like that needs snaps, that needs all the praise in the world, because as we mentioned earlier, you can't get everything in one session. It's become a pet peeve of mine. There's a lot of individuals out there who basically use their eval as like a sales pitch. And I don't think you should really have to sell yourself to anyone. I think people are going to want to come and work with you if you do a great job and you over deliver. And, you know, a week-long assessment is completely unheard of. So the fact that you actually take the time to look into these things and then build a program off of them instead of just looking at them and then saying, yeah, you need strength and conditioning, but not actually individualizing it to them, that's incredibly powerful and impactful. And taking it a step further, the way you incorporate the videos is absolute genius. And I'm sitting here asking myself why I didn't think about including that from a rehab standpoint, because there's a lot of people I work with day after day after day, but I'm lucky to see them twice a week. It'd be really cool if I had video of them doing their exercises when they're not in PT, or maybe if they had exercises recorded like that. And then if they do get injured, I have a baseline to, you know, view and assess of how they moved before their injury. So now we know what we have to get back to, or maybe there's something beforehand that could have contributed to that and we missed it. People make mistakes. Well, now we can kind of go back and review and kind of dig in a little bit deeper. And the more information like that you have, the more effective you're going to be, as opposed to just kind of guessing at things.
Right. Yeah, no, totally. And I appreciate that. It definitely evolved for me. Like since when I first started, like all I did was like, it was like a live, like 30-minute, like just assessment. I would watch them move, like similar movements to what I have like in the online assessment, but not as many like strength movements, which I think is so important. And then it's actually, I have to give credit where credit's due. I have a business coach. His name is Ray Gorman. He is also a DPT, and he actually, all that he does now is coaches DPTs how to do like basically how to do things online. So when I started working with him, I was already doing a lot of the things like on my own, but he's really helped me just like sort of, he's honestly helped me a ton in being able to like realize that I can do this. Like this can be what I do like online full time. So have to give credit where credit's due because the online assessment is totally all Ray. But I'm definitely never going back. And it's cool because he gave me the idea for the online assessment, but there's certain things that I think are really important that I will put in my own. So, and it's cool because you're already using the app. That way the person can also get used to using it. Sending form videos and things like that. So yeah, it's been really cool. It's cool to see it grow. And I'm really glad that I started working with Train Heroic because I kind of randomly started working with them a while back. And then they have like the ability to do like the subscription model and like sell like programs that are pre-written as well. So it's just allowed me to reach more people because obviously I can't work with everybody one-on-one, but a lot of people don't need, they don't need that like attention one-on-one all the time. If they don't have any injuries or anything like that, they just need solid programming, and a team to help hold them accountable. So that's also super cool.
Yeah, definitely. And I think you're up to 3.0 of form and function now on that note. Is that correct?
Yeah. And I actually, I don't know. I mean, I might do a home version of the form and function program, but I've shifted into the subscription, which I just like didn't really know what it was initially. And since I've been working with them more, I've realized it. But the subscription is essentially like it goes on forever, basically. And so it's similar programming to the form and function programs. Like it's also called form and function subscription. But instead of just like buying it and then having it forever to do whatever you want, you just jump in and you can do like as many training blocks as you want, and like the programming changes every 6 weeks. I give a little bit more like I'm in the chat more with the subscription and like those, because those people are like ongoing. So there's a lot more like things evolved and they're all doing things at the same time. So it's kind of nice to like be able to talk to the group because everyone knows what I'm talking about versus like when you buy the program and you do whatever, like people might be doing different things at different times. So it's been super cool to see them grow. I never would have, I literally just created the initial program because I was going into clinical rotations during school. And I was like, I think I'm going to be way too busy to like have one-on-one clients. So I'm just going to like, here's this program, just buy it if you want. And then it like, they were a hit. So, and I feel like I look back at like the first and second ones and I'm like, not to say that they're bad because I obviously think they're great because I made them, but I think 3.0 is definitely my favorite. And the subscription because I've evolved as a coach, so, and in my ability to like write things that look better and like are easier to understand has also evolved since those first earlier programs. So yeah.
Right. And I think that's a great point to hit on here as we start to wrap up too, Megan, is, maybe someone listens to this and they say, well, Dan, you bashed people way too much. It's completely okay to be new at something, right? I'm still very new to this industry. There's still things that I do and I'm like, wow, that really sucked, or I should have done it differently, or I could have done that so much better. It is okay to find yourself there, but it's not okay to stay there. So if you realize there's something wrong, and it's very easy to point that out in others, sometimes it's a little more difficult to look in the mirror and point it out within yourself. But if you recognize that there's a fault, do things that make it better or change it or, improve yourself so that it doesn't happen again. Allow yourself to suck for 5 minutes a day. And then you can learn, you can improve, you can be better. And when you get to version 3.0 instead of 1.0, you're like, wow, I love this. 1.0 was great, but 3.0 is like a whole new world.
Right. Yes. Yeah. I mean, if we're not learning, that's why I think, I don't know, just the number of people that you're able to work with, every single client teaches me something. So
yeah,
I'll be better tomorrow than I am today, hopefully.
You're just trying to create clinician version 2.0 at the end.
Yes, that's it.
Speaking of that, are you going to be like offering like a mentorship for clinicians or like a movement coaching course or anything like that for people who act in like the clinical side that want to learn from you more?
It's funny you asked that. Before I left my job, I was teaching like my PTA partner, like a lot of just kettlebell movements. That's a great skill to be able to teach a client because there's so many upflexible like movements with kettlebells. I would love to do that. I've had people ask me about it before. There are some great courses out there, like barbell rehab is a really good one. PPSC is another good one. I have not taken that course yet, but I know that they're both like, you know, very much focused on like tying trainers and clinicians together to like teach the clinicians how to do like the barbell movements, and then teaching trainers how to like recognize what's out of their scope, but also how to modify around pain. But the only issues with that is that I don't think barbell movements are for everybody. Like you don't need to do barbell movements. I think they're great to learn, but if you don't have any interest in doing it, like you don't need to, you know. And I think because we should be like breaking down barriers. We don't need to like create more, you know. So but yeah, I would love to start doing like workshops for just like thinking, like everybody thinks differently, you know. So, and I'm not like a dogmatic person. Like I don't only do kettlebells, I don't only do barbells, I don't only do like calisthenics. Like I try to do a little bit of everything, because I think when you do multiple things, you can recognize like all the commonalities, and then you have more tools in your toolbox for your clients who obviously they don't usually need like all the same thing. You know, everybody needs a little bit different. So maybe maybe mentorship, maybe long answer.
Be on the lookout for that.
Yeah. I have a couple of things that I'm working on for this year. I need to make my like 2024 vision board. So yeah.
Well, for people who want to keep up with all that you're going to be doing throughout 2024, where can they find you at, Meghan?
So the best place to find me is on Instagram, and my website and everything is linked on there. So that's all I'll give you. And it's dr.megsi, MEGSI.dpt is my handle. So message me. I try very hard to respond to all messages. Sometimes they're hidden, so if it takes me a little bit, that is why. But I try to respond to everyone's messages. So if you ever have any questions, please reach out.
That is awesome. We will link to that in the description below. So if you didn't quite catch it, you can just check out everything that Meghan is doing there. Is there anything we missed in our discussion today, Meghan?
I don't think so. I hope not. I feel like I talked a lot. I don't know if I made any sense, but
it made a lot of sense to me. Okay. And it reaffirmed my belief that you're an absolute badass and the field needs more people like you.
Thank you. Same to you, Dan. Let's just conquer the world together, shall we?
I'm not opposed. Always a pleasure, Meghan.
Thank you. You too.
Thank you so much for listening to this episode of the Brawn Body Health and Fitness Podcast. If you liked this episode, please make sure to share it with a friend, subscribe so you don't miss any of our upcoming episodes, and leave a review. This way we can spread knowledge and motivation and help reach more people. Thank you again for listening, and I'll see you next time.